Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron, and I'm here to bring you cutting-edge insights and practical strategies from leading healthcare experts for your journey to prime health in life and in business. Now, here's what I want you to think about for just a moment. Most of our guest patients arrive exhausted, gaining weight, not sleeping, and being told their labs are normal. But after working with thousands of people in one of the country's largest hormone clinics, today's guest, Dr. Karina Angiletta, is changing how we think about hormone therapy and what it really means to restore function. So I'm excited to hear more about it from Dr. Karina. Before we jump into the episode, just a quick message from our sponsor, Grow Solutions, where we believe brilliant healthcare professionals shouldn't have to choose between patient care and practice growth. We handle the tough stuff behind it to make practice easier. We eliminate things such as new patient and client acquisitions, marketing and growth strategies, reducing operational chaos with proven systems, frameworks, and SOPs, and also which of these AI bots out there should you implement in your business, because the robots are coming whether we like it or not. So we're not a vendor or an agency, we're your growth partner. So if you ever thought this to yourself, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we are your solution. If you're interested in a free growth consultation, just drop the word grow below, or feel free to DM me on any of the social platforms. But you came here for a reason, that's to hear more from our amazing guest. Dr. Karina Angiletta, welcome to the Prime Health Podcast, and please tell us a little bit about yourself and what you do.
Hi, Derek. Thank you for having me. My name is Dr. Karina Angiletta. I'm the owner and the main provider at Full Spectrum Health and Wellness here in Rostrum, Idaho. I've been in healthcare for 25 years, but my career started because I grew up in a family of physicians. My grandmother was an ENT, ear, nose, and throat pediatric surgeon. My aunt was an anesthesiologist. So I grew up hearing stories about patients and the excitement world that healthcare is. So as I was pursuing, as a young adult, pursuing career as an opera singer, I decided that on the side, I would acquire a real profession, something that was responsible of me. And I decided to get a degree in nursing. And my first job out of nursing school was an emergency room. And as I joined this exciting world where lives were saved and changed, I thought that this was something that deserves my full focus. And this is where I spent the first 10 to 12 years of my healthcare journey.
Wow. Well, thank you for sharing. That's a very unique introduction into going into healthcare. And I would be remiss if I didn't say, I believe you said you were an opera singer. I'd love to hear a little bit more about, not necessarily want to make you sing, but I want to hear a little bit more about that story, if you don't mind.
Absolutely. I started singing. My mother noticed when I was about 12 years old, my mother noticed that I was singing as I was washing dishes. My mother noticed that my singing as I was doing this was unique and beautiful, and she really enjoyed it. So she being very excited about that, she started taking me to different specialists and musicians to listen to me, to my voice and my singing, and just to tell me, is there really a unique talent? And many of them actually agreed that that was something unique and at such early age. And at that time, both my mother and I, but more my mother, that she got excited about the kind of created that dream that at one point I will become this very famous opera singer, and she would be the proud mother of this famous opera singer. So I've won some scholarships at universities, and but we immigrated to United States when I was 19. So I did join Indiana University, their musical program, and won a scholarship there. And in the first year or so, I did a lot of performing, which was incredibly exciting. But at some point, I realized that this could take much longer than were anticipated, and maybe I'll have real profession, that's something that can sustain myself and support myself. And this is when I decided to go into nursing, because this was something that I was also familiar with.
Dr. Karina, I know that you were involved in the emergency room as a nurse. You were there for quite a while, but then you started getting into hormone medicine. Why are you so passionate about that side of medicine?
Absolutely. After about 12 years in the emergency room, witnessing the same pattern repeat, patients cycling back with the same issues, obesity and metabolic disease, I realized that we're exceptional at managing crisis, getting patients back to basically life, saving lives, getting them quickly from the moment they enter into the emergency room onto the operating table where they have the balloon in their heart. However, what I've also been witnessing, that we're exceptionally terrible at addressing the pathophysiology that brought patients to the emergency room to begin with. So eventually I started shifting focus into the metabolic care, and ended up joining one of the largest clinics, one of the largest bioidentical hormone replacement clinics and medical weight loss clinic in California. And this is when everything changed. I witnessed updated protocols and how the updated thinking worked and the results it delivered. Some of my training started with a reading book that was called Bad Calories, Good Calories and Bad Calories by Gary Taubes. He is a scientific investigating journalist he was one of the pioneers who looked for the first time, at the science that was driving nutrition dogma, and actually reanalyzing the studies that were used to develop the nutritional protocols, and looking again at the fat and carbs. And actually, that was an incredible red pill moment for me. And that actually also was a very similar experience with bioidentical hormone replacement science. As I was getting my training in BHRT, I saw the very same patterns repeat. Very old studies dictating the protocols. Patients are not getting results. Patients are not happy, yet we are still practicing something that we were comfortable with. So this was something that really inspired me to also go into and earn my PhD, because I wanted to not only to dive deeper into the hormone science, but also develop those independent skills to be able to analyze scientific studies myself and really discern the quality of studies and how it can be applied to patient care. And in the middle of my PhD program, about the second or third year, this is when COVID happened. And again, another red pill moment when I realized and also witnessed the COVID management, or rather say mismanagement, how dogma, fear, experts who ought to be questioned were driving care and how we applied medicine. And that really solidified the way I practice medicine, always questioning, always looking for the updated science, and treating the patient, not the protocols.
Yeah. Yeah. Like the motto in healthcare and in medicine is always to do no harm. And unfortunately, in certain situations, we tend to not purposely harm people, but because we don't ask the right questions, like you're saying, sometimes we aren't giving them the best benefit of the doubt. And sometimes it's hard because our patients have Dr. Google and they have Instagram and they have YouTube and they think they know the answer. It's always good to have that conversation and be able to trust. So I think that that's very good for you to go through that realization yourself. It's very important. But Dr. Karina, you had mentioned BHRT, so bioidentical hormone replacement therapy. Now, there's been some controversy about it. Do you feel that BHRT is safe?
Absolutely. Not only it is safe, but it is a responsible medicine. what's actually happening, and some of the fears. For example, in the 90s, 1980s, 70s, you could go to your primary care physician and with your menopausal symptoms, and you would get some hormone help. What happened in the beginning of the 2000s, 2002, I believe, the WHI study, which is Women's Health Initiative Studies, it's a 1 billion study that was conducted to assess the safety of hormones. What's fascinating is that the study actually was poorly conducted, and the very initial results that scared everyone and made all the headlines were actually retracted later on, but that information wasn't shared as widely. So a lot of doctors, for a good reason, they didn't want to harm patients. So a lot of doctors overnight stopped prescribing hormones. What's fascinating is that the types of hormones they tested in the studies was actually synthetic progesterones and estrogens. What's fascinating is that the synthetic progesterone is still to this day is being used in some of the birth control pills. So to me, the way the miscalculation and mismanagement that came out of that study being publicized and then retracted, but not re-educated providers, actually did a lot more harm than good. And again, when we're using right now, we have decades of data on the bioidentical hormones and formulations that we're using. Those are not the hormones that were tested in the study, and those hormones have decades of safety data. I also prioritize safety, and we're absolutely go through screening, and sometimes I do get some pushback from the patients about the screening. Do I really need the mammogram? Do I really need a pap smear? And this is when the safety comes in. Yes, you absolutely do. Because what we also know, when we use bioidentical estrogen, although it may not cause cancer, as we know from many studies, what it can potentially do, it can drive the cancer that's already existing. We're really good at screening. Screening is affordable. It's most of the time it's included in your, in your insurance plans, and there is absolutely no reason to skip that. And that way, it allows us to practice BHRT safely and for the benefits of the patients.
Yeah, and that's true. It's unfortunate because many women have lost out on that ability to have it. They can still catch up on the back end and still see a great provider like yourself. So that would bring me to my next question about this, that who is an ideal patient to undergo BHRT therapy?
Absolutely. I work primarily with men and women over 40 years old. This is the average age of menopause is about 51. However, symptoms can start as early as in their early 40s. So this is when patients start feeling off, some symptoms are starting to appear. And a lot of times they go to their provider and they share that they're not sleeping well. There's some brain fog. They're witnessing changes. They're just not feeling like themselves. And a lot of times they'll look at the results and the blood work and everything looks normal, and they're just kind of left to deal with this. And I say that ideally we would have everyone test their hormones starting at 40 years old, or whenever those symptoms appear for the first time. Just getting the blood work done, just sitting down and looking at the symptoms, looking at the blood work, looking at what's optimal, looking at what's normal. And this is what my primary focus is on those patients who are starting to feel something not like themselves, like that aging is coming in, but they don't really have the answers yet. Let's look at the hormones. Those could be foundational and something that we can address early. The early, the better.
Yeah. Yeah. Again, it's a great point that you bring out that, when they see those symptoms coming on or when they believe they are, that's when they should get tested. Maybe it doesn't mean they have to start the therapy at that point in time, but they would have a baseline at that point, which is great. So somebody does some testing, maybe with you or maybe with their primary care physician, if they're watching or listening to this, and their labs say they're normal in, between a range of 50 and 225, and they fall in the middle, but they still feel bad. Why is it that people have normal numbers but still don't feel good?
Absolutely. I love this question, and I hear that all the time. So the normal is what normal lab range is a statistical average. And what we know about statistical average, we know that the average adult in America is inflamed, it has insulin resistance, is most of the time is on multiple medications, sleep deprived, and most likely obese or overweight, because we know 75% of Americans are, almost 75% of Americans are either obese or overweight. So as we look at that and think about those average normals, does average normal really reflect health, or does it reflect disease? And do you, as a patient, do you want to feel normal, quote unquote, or optimal? And this is when someone like myself comes in, we will look at the symptoms, and because symptoms are data, we'll look at the symptoms, and we will look at the normal, we will look at the optimal, we'll compare and talk about what those normal would look for a younger, healthier patient or younger, healthier self, and then decide, is there anything that we need to restore and optimize? Because as we are in our younger years, every organ, every cell is fueled by hormones that we're producing. As we lose that ability to produce those hormones, this is when the symptoms arise. And again, normal or optimal, those are two big differences.
Okay. Well, thank you for sharing that. I appreciate it. That brings me, like, as I've done some research behind on you, Dr. Karina. You're known for being very evidence-based with the research that you've done in the past. Now, are there some hormone tests that you don't use in some of the treatments that you do with your patients?
Absolutely. Thank you for asking this. This is a very important question. I would love many listeners to hear this. There's a couple of red flags that I see on a regular basis. And that comes to a couple those tests that I don't use. What I see used often is for hormone testing is Dutch test, which is the urine test, and saliva testing. Although they absolutely have their place and they're very popular in functional medicine world, what urine Dutch test is the testing metabolites of hormones. This is byproducts of hormones. The very similar applies to saliva testing as well. What it doesn't reflect, and we don't have a good measure to correlate those numbers to the circulating blood levels in your body. And what we also know through the decades of research, that the outcome based research is actually done with the blood levels. So we have an enormous amount of data on blood levels and how and what the blood levels should be in connection with supporting the brain health, supporting supporting the cardiovascular system, supporting the bone health. And we cannot we cannot lead our dosing or our levels based on the metabolites. Like I said, again, the Dutch testing could absolutely be useful in some situations when we look at the cortisol levels, when we look at the melatonin levels. There are no other better ways to test it. However, when it comes to bioidentical hormone replacement, we have decades of data that's connecting the blood levels, and this is the levels that we should be testing, and this is what should be guiding us into the adjusting the dosing. What I also sometimes see, and it's another red flag, that some clinicians, and unfortunately it's definitely something that could be improved. Most clinicians, even OBGYNs, do not get any training on menopause. So a lot of them are still, still trying to be helpful and maybe educating themselves. And what I also see a lot done by other providers, especially OBGYNs, is that they don't test at all. Some of them are just guided by symptoms, and this is very, very common. And that's, again, not the best way to practice hormone medicine, because, again, although some of the formulations like patches could absolutely help symptoms, but we also know that the blood levels should be at a certain level if we want to support the brain, support the bone, support the cardiovascular system. So the symptoms, to me, is only very tip of the iceberg. There's so much more to address in terms of hormones and how they are supporting every organ of our body. And this is exactly why we need to precisely test the blood, repeat it and retest it every time we change the dosing, change the formulation. We always have to correlate it with the blood test and the symptoms.
Yeah. Each individual is so unique, from genetic makeup to how much they exercise to the foods they consume. All of those things make changes. And you brought up something very interesting, Dr. Karina, in the fact that there are some physicians, primary care, OBGYNs, that don't ask the questions. And again, maybe because they just don't feel comfortable, which then secondarily leads people into trying to do research on their own. Dr. Google, YouTube, whatever it is. So there are some hormone balancing diets that are out there, and there's some other, like, let's say, herbal protocols that are popular. What are your thoughts about stuff like that?
Absolutely. Nutrition, sleep, exercise, those are foundational for health. I don't want to sound like those are not important. However, when it comes to restoring hormones, what I see sometimes online advertised as nutrition, hormone balancing diets. And I don't think that those could be applied to hormone balancing, because what we know as simple biology is when we lose that ability to produce hormones, there's nothing that can actually restore when the ovaries are aging, and there's such a process as atrophy. We cannot restore that process. We cannot wake the ovaries up. We cannot eat. There's not enough kale that we can eat to all of a sudden bring the ovaries back to life. And on a side note, if you do eat too much kale, and if it's raw kale, you can actually harm your thyroid. There's such a term as goitrogens that are present in raw kale. And if there is some kind of underlying thyroid condition, or there's not enough iodine, you can actually do some harm with too much kale. But that's the side note. But absolutely, that's just such a wonderful question, because I think that does patients some disservice when they're trying to balance it with nutrition or trying some herbal supplements. Again, I love everything natural. I stay on top of the research about some of the herbal supplements. One of them is maca, that is widely advertised as something that's balancing hormones. However, the research is very minimal on maca, and like I said earlier, we need certain levels of hormones. Let's talk about estrogen for a moment. Certain levels of estrogen that will support the brain, the health, the bone health, and the cardiovascular system. And unfortunately, what we see with maca research, although they will say that it was a significant improvement in symptoms, and we know that even with slight adjustment of hormones, some of the symptoms could disappear, like hot flashes or night sweats. We also never seen maca restoring hormone estrogen level to that helpful, supportive, long-term supportive for brain and bone health. So to me, a lot of patients could be wasting time with herbal supplements, playing that guessing game instead of testing and applying formulations that we know it precise the dosing, and we can see precisely how it affects their blood levels. So to me, the best form it is to test and use the bioidentical formulations that we are seeing are safe, effective, and really produce tangible change in symptoms and supporting the long-term health goals of patients.
Yeah, I appreciate that response on that, Dr. Karina. So that brings me to a question specifically that, we're addressing how they are safe, but I guess the question that leads after that answer is that yes, they are. But then how long can someone stay on BHRT therapy?
Absolutely. Wonderful question. And to back up for a moment about the safety, there are some patients for whom BHRT is not an option. There could be some active cancer or a few other, or active stroke or a few other instances. And this is why it's important to really sit down with someone and assess that safety profile. So, but again, those are very, very few patients. For the majority of us, this is foundational to restore something that our body was producing for throughout our younger adult life. But again, would you remind me the question?
Yeah, absolutely. The question was, how long is it for, how long or how safe is it for people to be on for hormone replacement? Like, is there a time frame that they should stay on or get off?
Absolutely. Wonderful question, and something that I get asked very often. For as long, and the answer is for as long, unless there is some safety concerns, for as long as you want to feel optimal, for as long that the symptoms are addressed. And some patients will choose to try some time off just to pause it for a second, and they do feel how the symptoms return. And that then becomes a question of how long would you like to feel optimal? And for most of us, we would say for the rest of our lives. And that also brings me to some of the suggestions about safety screening. Like, for example, the CDC would recommend us to stop screening women at 65 for cancer, for pap smears to stop at 65. And to me, that risk of developing cancer is actually increasing with every year that we get older. So one of the reasons that they recommend us to stop is because of the life expectancy. But also we know with hormones, we're hopefully prolonging life. So to me, there's no reason to stop testing for cancer if we're looking at extending life. If we're looking at living longer, we should be testing for safety and using hormones to support health.
Yeah. Again, it comes into medicine wanting to do well, but not always thinking the right way. If we have a long lifespan and a good health span along the way, you should be testing that. If we are taking hormone replacement therapy, male or female, and they're getting better, why not continue to test? If they do have a cancer diagnosis, why not catch it instead of it just popping up, unfortunately, along the way? So
Absolutely.
Again, one of those kind of odd situations when it comes into healthcare.
Absolutely.
It's not. Dr. Karina, I'd love for you to share maybe a success story or two of some patients that have gone through care with you and how they've improved their lives.
Absolutely. Thank you for that question. I do, and that what fuels my work. I do hear on a daily basis feedback from the patients, and that's so absolutely inspiring about how they're feeling like themselves again. For, the sleep is restorative, the energy is back, the libido is alive again, the brain fog lifted, they're full of energy, the life force is back. So that is very common, and you can never get used to it, but it's still something that I hear so often. The one interesting case that I was reminded of recently, and that would really shape my view on hormones and on medicine as whole, was actually a teenager, a case that I met a teenager in my primary care rotation in school. That was about 10 years ago. And it was a teenager with depression, and he's been going through depressive symptoms for, I believe, for the past 3 years, and it was really hard on the whole family. He had a team of mental health professionals, everyone working very hard to even keep him alive. He was just, not engaging. His grades were very poor, not social, suicidal. So the family is suffering. He is suffering. The mental health professionals did not know what to do about him, and until the doctor that I was following, decided to simply test his full thyroid panel. And it was astonishing. What she discovered is that he was severely hypothyroid. And again, it is rare in teenagers, but it does happen. So this is why we don't test it on routinely, but this is something that clicked and connected. And it was a very simple and straightforward treatment. So he was just taking thyroid replacement like many people do on a daily basis. And it was a complete rebirth for him. He was just a new person again. And just to see the suffering that that family went through and the patient, and when the answer was so clear and so straightforward, that actually is such a moving case that I think that most people, if some mothers are listening, if you see some of those symptoms that you recognize, it's such a simple, full thyroid panel that you can ask for, simple blood draw that can give a lot of answer and can really change someone's life.
Yeah. It's truly sad at any age when somebody, goes through those problems, but to see a teenager suffering from that, when going to their medical doctor, physician, and thinking, well, we're doing everything we can, we just don't have an answer. So I'm glad that doc stepped out of the box, out of the comfort zone, did some testing. It's beneficial for that. So
Absolutely.
From a business perspective, Dr. Karina, where do you see, what's the vision for you and your business over the next 3 to 5 years?
Absolutely. I'm very passionate about what I do. I'd love to, I started my business because I just couldn't keep, the knowledge, the skills. I wanted to serve our community here in Idaho and Washington. And my dream is, on a large scale, is for hormone care to be routine, for every doctor to be able to afford to offer it to the patients. However, I still see, even with some of the latest CDC changes where they're removing some black box warnings, I still think that in order for them to fully get on track with hormone therapy, it's probably going to take another decade or two. So, and it's going to be people like us being able to reach out to more and more patients, to be able to offer those services to more patients. So basically growing my business, being able to offer those services to more patients, that what I think ultimately would be my dream.
Yeah. And you're in Northern Idaho where you practice, and do you take patients in your practice as well as telemedicine?
Absolutely. So I only offer telemedicine. My original thought was trying some telemedicine and see how it goes, and maybe eventually opening a physical location. However, what I'm witnessing is that a lot of patients love that convenience. And I see a lot of patients throughout the whole state of Idaho and Washington. And I keep my practice intentionally small so I can offer that personalized care. And I keep my initial consultations goes from 60 minutes to 90 minutes. This is something that to go deeply and to listen to the patient, to listen to their about their symptoms, to see their journey, to look at the labs, and we go line by line with each patient, what hormones, which hormones it is, how it connects to the symptoms, what options they are, what formulations could be working. And sometimes I will let them know that maybe it's not the time yet. Everything looks okay for now, and maybe there's some supplements that could be helpful. But most of the time, there is something that I can offer in terms of hormones. So yes.
Yeah, excellent. Well, Dr. Karina, you shared a tremendous amount of information. I'll have all of your links, like your social links and your website and that. But if someone is interested in learning more about you, where would you like to direct them to learn more?
Absolutely. They can go through the fullspectrumhealth.co website, and they can apply for a free complimentary 20-minute consultation. This is where we can get on the phone and talk about them and see how I can be helpful. So right now they can just go in and book that appointment and get on the phone with me.
Okay. I'll make sure, again, we share that link. So I've got two last questions for you, Dr. Karina. You being a healthcare professional, if you could give us one piece of advice that would affect our life in a positive, healthy way, what advice would that be?
Thank you. As I was thinking, we hear a lot about stress and how stress negatively affects our health. But so I'm not going to be discovering anything new there. However, what I do want to share is the hormone perspective of stress. So our sex hormones, progesterone, testosterone, estradiol, estrogen, they all start as cholesterol. And this is why we could go into another conversation about cholesterol lowering medications and how the science is outdated on that part as well. However, we'll just stick with the understanding that all sex hormones start as cholesterol. And then it converts into the pregnenolone. And what pregnenolone is we call it mother hormones. This is basically that mother hormone, which then converts into DHEA and then into testosterone and estradiol, and pregnenolone also converts into the progesterone. So basically all of those wonderful hormones that we love and use every day. What also is interesting that same pregnenolone also converts to cortisol. And what we know about stress raises your cortisol. So what happens is the process called pregnenolone steal. So when body needs to when body is under the stress, it prioritizes making cortisol. So when that pregnenolone, and I have this wonderful chart that I show to all of my patients to inspire them to look at the stress differently again, is that body will prioritize making cortisol, and then your other hormones are suffering. And we see it from study to study how stress is connected to lower levels of testosterone, for example, and all of the other hormones. So again, there's so many tools out there that you can apply, whether it's breathing or meditation, or maybe even simple decision to just take life a little bit easier, that making that decision. But now you have another reason to actually manage that stress, knowing that it's actually going to beneficially affect your hormones.
Fantastic answer. No one has brought that up yet. So very unique. I appreciate that, especially from your perspective. So the last question I want to ask you, Dr. Karina, you've been a wonderful guest on the Prime Health podcast. What would your definition of Prime Health be?
Wonderful question. I was thinking about that, hearing your other guests answering that. And there's a saying, I'm curious if you've heard about this, youth is wasted on the young, and wisdom is wasted on the old. So I'm not sure who the author is. Is it Mark Twain or someone else? But I've heard this a couple of times. And what it actually implies is when we're young and have all this energy, we don't have the wisdom. We don't have the perspective, and we make all this mistake. We're restless. We're, just living through this, without the wisdom. However, once we earn that wisdom, we earn that later in life. You have to, unfortunately, it only comes with years. Then all of a sudden we'll realize that we don't have the energy. So to me, Prime Health is we can have both the energy and the wisdom. And unfortunately, there is no treatment no pill yet developed to, the wisdom pill. We don't have that yet. What we do fortunately have is restoring as close as possible, restoring those energy level, the life force, the libido is to our younger years, where we can actually live that chapter that we earned, but with our younger selves, energy and health.
Yeah. Well, I think the work that you do gives us a better lifespan with better health along the way, so we can regain that. But I'm sure I'm like other people are here. I wish I could tip myself upside down and get that sand to go back into the top of the hourglass and get a little bit back. But such is life and how we were created. So Absolutely. Dr. Angiletta, I truly appreciate you being an amazing guest on the podcast. You give us a very unique path into healthcare. And then from having family members that are in it, then you starting out as an opera singer, which is fantastic. I'd love to hear you sing at some point in time to see what you can do. And then realizing that you wanted to go into healthcare. And then there was a passion that said, what was happening incorrectly around the patients I was at? you transferred, you made a pivot in that, and now you've started your own practice to help people here in the northern Idaho and eastern Washington area. So I really do appreciate the fact that you do that. I always say here close to the end of the podcast, I ask people to make sure they subscribe. We would love to have more people listening to our amazing guests that we have. And as I wrap this up, until next time, I always tell our members here that remember, true wellness is a journey we are all on together. Now, whether you are taking charge of your own health or guiding others in theirs, every step forward matters. So please do stay committed to your Prime Health journey. And again, Dr. Angiletta, thank you so much for being an amazing guest on the Prime Health Podcast.
Thank you so much for having me, Derek. Have a great day. Thank you.